Okay, so today we're going to be doing trach care. I do not have a real catheter, so I had to kind of manipulate one. Basically, the first thing that we're going to do is suction the patient. I'm going to come in the room, wash my hands, identify the patient, verify that it's them. Going to talk to the patient about what we're going to be doing. I'm going to say, hey, we're going to suction out your catheter. We're going to release all those secretions that'll help you breathe easier. And I also let them know I'm going to make you cough when I suction. The point is to get the suction in, initiate the cough reflex, and then suck out all the secretions. Okay. This is a sterile procedure, but before I do that, obviously I'm going to wash my hands. I'm going to don my face mask. I'm going to put the patient in a good spot. We're going to put them in semi-fowlers because they're going to be coughing, and we're going to assist them to a comfortable position by raising the bed. We're going to drape them with the towel, a clean towel, and then, so basically then I'm going to open my kit. In my kit, I'm going to don my sterile gloves. I'm not going to don my sterile gloves for this one because I only have one pair, and I have to get my catheter ready. Catheter is sterile. Before I go and do all that, I'm going to turn on the wall suction because you need that. I'm going to get in the sterile basin, I'm going to pour my sterile water because that's going to help me clear the line, make sure my suction's working. Okay, it's also going to clear out any secretions if I need to suction more than once. Okay, so in this instance, I have my little water here, and I have my catheter. I'm going to hyperoxygenate my patient for at least about a minute, and the patient's going to be in understanding. Okay, so basically I have 2 sterile hands, and this is not a real catheter, so kind of bear with me here because it's long, really long. Let's see if I can just undo it. Okay, when I do this, when I wrap this, I'm going to be wrapping around, okay, because you need to manipulate this a little bit. Sometimes these come out, these are a little hard to move or hard to grasp. You need to warm it up, make it pliable. So at this point, my patient is still being hyperoxygenated. I am going to dirty my left hand, will not be sterile anymore. My right hand, in this case, will be sterile. I'm going to attach my catheter to wall section. I'm going to clear my line. I'm going to make sure that my suction's working. So I'm going to go right into the water, obviously not a water bottle, but I'm going to go right in. I'm going to use my suction. I'm going to push down on the suction to create that suction instead of it going through the vent here. I'm going to clear my line. Okay, looks good. My suction's working. My patient's ready. Going to attach this to wall section. Say this is on wall suction now. I'm going to remove my patient's oxygen. What I'm going to do is I'm going to go in. Okay, I'm going to go right into the cannula. And I know you probably can't see this, but when I reach that cough reflex, that patient's going to cough. I'm going to apply suction and I'm going to pull out. Okay, and I'm kind of going to go in a circle like that. Oh, all right. So when I'm done suctioning, what I'll do, I should suction for no more than 10 seconds. And then I'm going to replace the oxygen. I'm going to take this, I'm going to wrap it around, because I'm going to take off my glove and put this in there, throw it away. You're done with that. All right, so if you need to do it more than once, then you will be clearing your line. But in this instance, patient didn't have any secretions. So beforehand, you can listen to breath sounds, see how they're sounding. If they have crackles and everything, you can ask them to cough. Encourage deep breathing, encourage coughing, because you want to get all those all those secretions out. All right, so my next thing is the same thing. You're going to verify your patient. You're going to perform care of the trach site now. We're done suctioning. If we need to do it again, we can. But in this instance, I already did it. It's good. So what we're going to do first is we're going to let the patient know what's happening. Obviously, we're going to wash our hands. We're going to... I just lost my train of thought. Basically, okay, so you're going to tell the patient what you're doing. We're going to change out your dressing. We're going to clean your inner cannula. And the patient says, yes. Okay, great. So the first thing I'm going to do, because this is not sterile, is I'm going to just don clean gloves after I wash my hands. We're going to remove that patient's little gauze that's around his site. Okay, we're going to look at that. Is there anything weird about it? Is there any weird drainage? Is there, so we're going to assess that. That'll go away. So basically all that's left are the ties and the inner cannula, because we're going to need to clean that site. And once you're sterile, you don't want to be taking that dressing out, because that is not a sterile dressing. So basically, before I do this, I'm just going to roll up my sleeves. Okay, my hands are clean. I'm going to open my kit. I know you can't see this very well. I'm going to do the best I can here. Going to don my sterile gloves. There's one, this one. Just gonna go underneath like this, and I'm going to don my second sterile glove. Going to set my field up. Okay, the 1 inch margin on the outside is considered dirty. I'm going to go ahead, I'm gonna take out my supplies, which it looks like I have 2 hydrogen peroxide here. I have my normal saline. I have, what do I have? Let's see. Whoops. Okay, so I've got some Q-tips, which I'm going to clean around the site with. I've got some pipe cleaners, which I'm going to dry the cannula out with. And I've got a, looks like a little bottle brush, cannula brush, that I'm going to clean the inside of the catheter with. Okay, so I've got all that. I've got my new 4x4 dressing, split sponge. That's good. I've got my drying gauzes, which is also good. I'm going to put that. I hope you can see this. For the sake of the video, I'm just going to move this down. I know that's not the best view. And I've got my trach ties. Okay, so my trach ties going to go on here. All of this stuff is in the middle margins. First thing I'm going to do while I'm still sterile is, I know I'm sterile. I have to do this for the video. Let's see if I can just turn this. That's good enough. Okay, so with my sterile hands, this will not be on my sterile field. I'm just doing this so you can see it. I'm going to pour in one of these compartments is going to go my, what is this, 100 mLs? Yeah, it's 100 mLs. It's gonna go all in one little compartment here. This is done. I can open and close this because this is sterile still, and my hands are still clean. So that'll go out of the way. And the other little compartment, I have hydrogen peroxide. I'm going to go ahead and put that in my other little compartment, and this hydrogen peroxide is going to be used to actually clean the cannula, and then it's going to be rinsed in the saline. So I'm going to empty this. That's good. This is still sterile. I'm throwing that away though, because now I've got all this. Okay, at this point, I just want to make sure that all my little stuff here is in good standing so I can grab it. There's that. Obviously, this is not going to be in the picture. Like I said, we're going to, I don't have a real cannula, but at this point, one of my hands will be dirty. I'm going to keep my right hand sterile because I am right hand dominant, okay? And we're going to remove the cannula. We're going to take that cannula, we're going to dunk it in the hydrogen peroxide, right? And then at this point, I can take one of these. While that's soaking, because you do want to soak that for just a minute, I can take these and I can dip them in the saline. And what I can do is I can stabilize, what am I trying to say? The trach site with this one, and I can clean underneath with these clean ones. You don't want to go all the way around. You just want to clean them in little sections because these are sterile. It is a clean area there. So then you'll throw these away. Okay, I'm just gonna do one for now. Basically, I've removed my cannula here. Cannula's already in the peroxide. When I'm done with that, I'm going to take it out. I'm going to use my little bottle brush here while I'm holding it. Right, I'm gonna, I'm gonna scrub it out, and then it's going to go in the normal saline. Okay, Once it's in the normal saline, it's going to be rinsed, and then we can take it out and we can dry it with those pipe cleaners, okay? These little pipe cleaners here, that's to dry it. All right, and you can just stick it on these dry dressings here and get it nice and patted off. And then from this point forward, this cannula is totally clean. So what I'm gonna do is you can go from this side and you can hold the trach ties in place with your thumb. You can take this little clean catheter we have, the inner cannula, and sorry, I keep saying catheter, I mean cannula. We can put this little cannula right back in, make sure it goes in smooth, okay? And then at this point, you're done pretty much with the sterile. You can do clean. You're gonna replace your little split sponge here. It's just gonna go right up. You know how split sponge goes. I'm gonna put on some clean gloves because these did get dirty. Clean gloves, and then we're gonna replace the trach tie. The important thing about the trach tie is you only wanna undo one side at a time. You don't wanna take the whole thing off, okay? So there's like a little, this thing, there's like, here's where the cannula is and here's where you tie it. Okay, so you're gonna tie it on both sides, but you're only gonna do one side at a time. And what you're gonna do is you're gonna loop it through. It's hard to show you, but you're just gonna undo one side and then you're gonna loop it. Loop one side through, help the patient hold up their head, right? And then you're gonna come to the other side, you're gonna undo that side while you're holding it, because you really only want one side, keeping it taut at all times. You don't want to let both go, because it might knock that cannula out of place and that patient will have a serious issue. And then you're gonna come back over, and once it's looped through one end, you're just gonna go ahead and tie the second end. All right, when you do this, you want it to be tight, but not too tight. You wanna be able to get 2 fingers up in there. You don't wanna be choking the patient though. Basically after this, I'm going to remove my PPE, wash my hands, I'm gonna chart. I'm gonna ask the patient, how was that? Patient will tell me, oh, I was a little uncomfortable or whatever, you know. So you're gonna document how they took the procedure, what you did on the procedure. You're gonna document that first dressing, that dirty dressing that you took off. You're gonna say abnormal amount of drainage, you know, serous sanguinis, whatever, whatever it looks like. So that's that. I mean, basically that's trach care. Once you're dealing with the cannula and you're in their airway, those are both sterile, because you can't be putting dirty water or dirty fingers on your catheter and then the catheter going into their airways. That's how you give infection. So anyways, I hope that sufficed. Have a good day.